Welcome back again to the Medical Laboratory TV channel. It has been quite long since we had our last video. Um, of course, it has not been intentional. We are still doing one, two, three things down here to ensure that you get your videos on time. I'm promising you that moving forward, this is going to be regular. We are going to set a time when we are going to be having the new videos. I think that's amazing. For those who have never watched any video from this channel, this is the Medical Laboratory TP channel. That is the current is meant to be the current voice of the medical laboratory professionals in Kenya. Uh, we are hoping that we're going to speak your mind. We're going to give medical laboratory to all Kenyans to understand what we do, how we do it, and what it means, what we do. The results of what we do. But that's a discussion that will come at a later date. It's me, your usual medical laboratory doctor, Isaac. Yeah, yeah. I'm going to be taking you through whatever we'll be going through most of the time. First, I would like to request everyone who has not give me a subscription to kindly do so. Down there's a red button. You can click on the subscribe button and put on the notification icon. Put on notification, so every time we upload new videos to this channel, you're notified, and they're going to be very informative. That's a promise. And if you do that, you'll have supported me, you'll have supported this channel, and you'll have added a voice to the medical laboratory professionals who are practicing in Kenya as at today. So my today's talk is targeting all medical laboratory professionals, be it a technician, be it a technologist, be it an officer, or a medical laboratory specialist that is currently practicing in Kenya but is struggling to find their identity. You're in the right place, I assure you. Even the medical laboratory students who are still in colleges and universities, you chose a very noble profession that is meant to change lives, and we hope that it's going to change life. It's going to change your life and then eventually change the life of a patient. So if you're that medical laboratory professional, medical laboratory student, then today's presentation is meant for you. So I'm requesting that to listen till the end. It is not sponsored by any organization. It is not sponsored by any union. It's not sponsored by any association. I know most of you have heard about NUMLO, which is the National Union for Medical Laboratories Professionals. It has not sponsored this talk. It is just something that I felt like I needed it to come to your attention. Have you hit the subscribe button? Those who haven't, please do. And kindly watch today's video to the end. There are certain things that are very important that I'm going to highlight about this profession at the moment. Yeah, and I'm well hoping that all of us are well. We are practicing as we should. We are doing our best as we've always done. It's very good if you're doing that. I'll start off by saying that when Barack Obama was taking over the mantle of the leadership of the United States of America from George W. Bush back in 2009, among the many things that he said was in his inaugural speech was this, and I quote, that America has moved forward from not simply because of the vision and skills of those in high offices, but because of we, the people, who have stayed faithful to our forebearers and true to our founding documents. So he was highlighting that the US has been how it is because of the people, not because of the leaders. So today I want to speak largely to the medical laboratory professionals who have lost, who are looking for their identity, who are somehow feeling lost. And I agree with you that for far too long, most of us medical laboratory professionals have struggled to find our identities. We've start we have struggled to find work. We've struggled to find variable pay. We've struggled to find good working conditions as the other professions have, and we've struggled to just get this profession on track because for long this profession has experienced a number of things that we have pointed out in the past. Some of us have been in this for far too long, and we pointed out with the people that we work with, and it seems like we are not very much listened to as we should. So I'm very much aware because you and I share this profession, and at some point and at any level that you've worked, and or any level that you're working at the moment, be it a public health hospital, in a health center, in a dispensary, in a level 4 hospital, level 5, level 6, the National Research Center, Medical Research Center, that is KEMRI, those who are working for the partner organizations in the Ministry of Health, for example, ICAP, FACES, Maryland, CHS, we have EGPAF, AMPATH, USAID, we have so many of them. Those who are working for standalone laboratories like Pathcare, like Lancet, like Metropolis, and a number of labs that have just come up. Most likely at some point you felt that you've been left out in the key operations of the organization, in the management, in the promotions, in the allowances, and you also always just feel like they discriminate numbers of employment when recruitments are done. And most of us have gone through adverts. We go through adverts because a number of us are still looking for jobs here and there. So you go through adverts and you find that we need 100. Sorry, before I get to that, the nurses, you look at an advert and you find that the advert says that we need about 30 doctors, and then we need 120 nurses. We need 30 clinical officers. When you come down to laboratory, they say that we need 8 laboratory technologists who are going to be serving patients who are coming from all these doctors, all these nurses, and all these clinical officers. Now, even in hospitals, for those of us who work in hospitals, we feel like you're not given the overall management positions. So look at our hospitals, look at our dispensaries, look at our health centers, look at our level 4, level 5 hospitals. Do we have any medical laboratory professional in senior management of these hospitals? The other day, we've always known that management, or we've been used to that character that or the lifestyle that management of hospitals are reserves of doctors. And even the other day as KU Teaching and Referral Hospital, a nurse is the CEO. I'm told he's a professional lad and a professional nurse. Alipigwa vita na madaktari vibaya sana. If he stood down, he would have resigned and ran away. But I'm very glad that even in his capacity as a nurse, he held on to that to that position. And the union, the National Union of Nurses, came out, guns blazing, fighting for him, that even nurses have the right to be administrators. But even in these smaller hospitals, the smaller healthcare setups, do we have medical laboratory professionals in management in a health center? Can a medical laboratory technologist be the facility manager in a health center? Do we have one? No. In a sub-county hospital? No. In a level 4, level 5 referral hospitals, those ones we can't even discuss in this setting. So we always just feel like we are not promoted like the other cadres that have um, very clear schemes of service. So what's happening to medical lab? Do we have a working schemes of service? I think this is a question that should be posed to the Ministry of Health, and if possible, NUMLO and KMLTTB and the association, if we have a working schemes of service for medical laboratory professionals in Kenya. So we normally feel that we are not promoted the way the doctors, the clinical officers, the pharmacists, the dentists, the nurses, or the other cadres are promoted. Yet they have higher risk, health risk allowance. Yeah, they do. Laboratory technologists will literally be paid about 3,000. I think it's 3,500 in the Ministry of Health. Those were in the government. Are paid about 3,500, if I'm not very wrong about the health risk allowance. But the other cadres are paid higher, some 10, some 15. But again, who is exposed? Is it true that medical laboratory professionals are not exposed to these health risks? You handle samples that are very infectious. The COVID samples, for example, previously people didn't want to come close to guys who are infected with COVID, the anthrax. You are the guys who actually confirm these contagious infections, do the testing on these samples, but your health risk allowances are still low. Some of these cadres have got non-private practice allowance. None of us have it. None of us have it. You know, I've talked about the advert. So the understaffing is just so overwhelming. So you walk into a facility with 4 outpatient consultation rooms. So 2 are working optimally, and then there is an ANC clinic with maybe a doctor and a nurse who are seeing mothers on ANC with inpatient capacity, with just 4 laboratory technologists on duty. So you handle the 2 patients after every maybe 5-10 minutes from the consultation room, from the ANC clinic, from the CCC clinic, from the wards. So you are handling all these things, but they're just 4 of you. So it's like you're taking patients from 10 different outlets at any given time, but they're just 4 of you who are doing the testing. So when you come from work, your working hours are not harmonized with the rest. Your pay is not harmonized with the rest, because a while ago I used to see here around that you find a facility with a clinical officer, a nurse, and a medical laboratory technologist who are having the same qualification. They are all having diplomas. So you'll find the clinical officer, the small clinics, paid in the small clinics. There's a scenario I'm painting. You'll find the clinical officer being paid about 80,000 or 60. The nurse is somewhere around, the nurse maybe about the same. And then the laboratory technologist is paid a paltry 20 or even 30,000, but it generates the most revenue in that specific facility. You're feeling lost. You're feeling lost. So you're generally feeling down and you're not proud of the professional path that you took. But wait. All these things are not because of the fact that Enoch Wanyonyi or Cliff Randa or myself, even though I'm not a union of a union official, or I'm not in any leadership position in the medical laboratory uh, practice in Kenya. It's not that it is not because of that leadership. It is not because your guy, if I say Gerald Omolo or Otoman Adele, it is not because Gerald or Dr. Adele is not in leadership because this is happening. You know, we've all pushed ourselves into this situation. Yeah, it is because of us that this has happened. The historical lowest levels of organizations, laboratory technologists have never been organized. Actually, it's the first time that we are just trying to organize ourselves. I remember when a union was getting registered back in 2014. We fought for this union. We fought for this union. We came here and, you know, we were just trying to get you together and just organize ourselves for the first time since this profession started commenced since we started having medical laboratory practice in Kenya. So we've always had our own inflicts and infights amongst ourselves. So even currently, I know there's a very serious fight between people with a degree and people with diploma. So there are people who are feeling that they are more entitled to this profession than the others. You know, these are the fights that have made us who we are. You know, I get a job offer and they want to pay me 30,000 Kenya shillings in a month, and I walk out because I cannot take 30,000 shillings in a month. But someone else comes after me and takes 20,000 with the same qualifications. How desperate can we be? How disorganized can we be? You know, this has happened year in and year out. We're just trying to pick ourselves up. So now we are feeling that we've been pushed to the periphery because of this these misfortunes. And I want to tell you something, that these employers you are seeing here are so happy about that. They are happy that you are not united. They are happy that you cannot speak for yourself. And they are happy that there is no one, absolutely no one, who is speaking for you. Because you cannot organize yourself and speak as one voice. So if you're struggling to get through an identity, how have the other professions got their identities? Through unions. Unions, people unify themselves and then fight for a common goal. Do laboratory professionals in Kenya have a national union? Yes, they do. They do. It was registered back in 2017 after a scathing court battle that I know most of you never contributed. It was expensive. One of these fine days I'll invite Enoch, Wanyonyi, Cliff, Ottoman, Benjamin from Kisumu. So many people. We have Godwin, we have Gerald, we have a number of people who fought for the registration of this union. We'll invite them here and share with you how much exactly was used in having that YouTube union registered. But now its registration has not brought any difference. If it has, then it's very little. Why? Because none of us is still contributing to strengthen that union. Are we having any monthly remissions to this union? From you? Do you remit anything to this union that each time you have a problem, that you're having an issue, you expect it to fight for you? But are you giving it anything? Are you giving it any strength? Acha niwaambie kitu. Nguvu ya union is in the numbers. I remember when lawyer Gibson Kuria called us for the ruling that gave Numlo its registration. He told us that there is strength in numbers. So on the day of the ruling, I want you to come to court in numbers. Do we have the numbers in Nunglo? I mean, even the people have mentioned that might be the former officials of the union. They might not be. Actually, I'm very sure they are not the current. Uh, they are not in the current leadership of the union, but there is strength in the numbers of a union. And after the numbers, the next thing is money. Hauwezi expect union ikufaitie kama haina pesa. Haina pesa. Your secretary will be bought out. He'll be on a negotiation table with your oppressors. And then because you've not paid him and the union has no money, he's bought out and he sells you out. Yeah? So it is very important that you get your identity. And the first action of you getting your identity is you subscribing to a union. All the medical laboratory professionals, there's a union called the Kenya National Union of Medical Laboratory Officers, NUMLO. Subscribe. Remit something every month. Let the union have money. Let the union have money. If it has money, it has numbers, it will fight for you. Let me tell you, you won't be oppressed by anyone because NUMLO will always be there. The same way you've always seen the union of nurses. Nowadays you see a lot of KUKO. You see the doctors union is very powerful because they are properly funded by the doctors themselves. They speak for their people. So for us, we expect not to contribute. We sit and then we are so suspicious with our money. We are told that we need to have a subscription of maybe 500 shillings a month or 1,000. If there are 2,000 of us, how many medical laboratory professionals are currently registered in Kenya? More than 15,000. How many are practicing with stable jobs? Probably more than 5,000. But how many of those more than 5,000 or more than 7,000 are remitting maybe 1,000, just 1,000 shillings every month to the union? The Secretary General to NUMLO one of these days will give us that insight. But I believe they cannot be more than 100 people. So 100 people we multiply by 1,000 gives you something like 10,000. So if you are remitting 10,000 per month to a union, can it fight for you the same way that a union that is having monthly remittance of close to 20 or 30 million? I mean, you need to ask yourself this question. And I believe the same way Barack Obama said, there is power in we, the people. There is power in we, the laboratory professionals. It is upon you and it's upon me to get up our identity. And getting our identity is owning up this union. They've not sponsored this today. They haven't sponsored this today. So let's not have that discussion. They haven't told me to talk about this. But I'm advocating for each and every one of you to make a subscription to NUMLO. If possible, if you have a stable job, stable employment, give something every month that this union can be able to fight for you. Fight for your schemes of service. Fight for your promotions. Fight for your allowances. Fight for your remunerations. And even those in private, you're not left out. You need to be members of this union. It is the moment that we stopped the professional jealousy amongst ourselves. It's time that we took our space that we donated to the other professionals. And that is why we have so many tests nowadays being done outside the laboratory. And us coming to ask you for a urinalysis strip. Do you have those dipsticks? That unajua ile test ya malaria tunaweza fanya. The CHWs have been given test kits. They're going to be testing in villages. People who never stepped in medical classes. None of them start in those classes. But they're going to be testing. We have so many other tests that are done by non-medical laboratory professionals. Almost each and every pharmacy you walk here in town or anywhere else, they have a lab, a working lab. But this lab is not operating by a lab, is not operated by laboratory technologists. A pharmacy in town is selling laboratory reagents. Not one, not two, not three, not four, not 10. Almost all of them. So for you to get a voice, for you to get someone who will fight for you, own up this union. And you better take up this space before it's too late. Because you do this when it's late, things will not be very good for this profession. I'll stop it at that today. May God bless all of you. May God bless all the medical laboratory professionals in Kenya. Let Him speak to your heart that you own up this newly registered union that is yet to get its teeth and its strength. That's all from me. That's all from me. So for those who haven't subscribed to this channel, kindly do. That is the only way you can be able to subscribe, to support this channel. Tuache wivu. Give me a subscription pale chini. Give me a subscription. God bless you. God bless all medical laboratory professionals. And you guys have yourself a nice time as you do your thing. This is your profession. Fight for it.